Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. The posterior leg muscles. The posterior compartment of the leg contains 7 muscles and can be subdivided into superficial and deep compartments. The muscles in this compartment act to plantarflex and invert the foot. They are innervated by the tibial nerve, a branch of the sciatic nerve. Blood supply chiefly from the posterior tibial artery. In this video, we shall look at the anatomy of the muscles in the posterior compartment of the leg, their attachments, actions and clinical correlations. Superficial compartment. There are 3 muscles within the superficial compartment of the posterior leg. They all insert onto the calcaneus heel bone of the foot via the calcaneal tendon. To minimize friction during movement, there are 2 bursae fluid-filled sacs associated with the calcaneal tendon. Subcutaneous calcaneal bursa lies between the skin and the calcaneal tendon. Deep bursa of the calcaneal tendon lies between the tendon and the calcaneus. Gastrocnemius. The gastrocnemius is the most superficial of all the muscles in the posterior leg. It has medial and lateral heads and forms the characteristic calf shape of the leg. Attachments. The lateral head originates from the lateral femoral condyle. The medial head originates from the medial femoral condyle. The 2 heads combine to form a single muscle belly. Distally, the muscle belly converges with the soleus muscle to form the calcaneal tendon. This inserts onto the calcaneus. Actions: plantar flexion at the ankle joint and flexion at the knee joint. Innervation. Tibial nerve. Soleus. The soleus is a flat muscle located underneath the gastrocnemius. It gets its name from its resemblance to a sole, a flat fish. Attachments. Originates from the soleal line of the tibia and proximal fibula. The muscle converges with the fibers of the gastrocnemius to form the calcaneal tendon, which inserts onto the calcaneus. Actions: plantar flexion of the foot at the ankle joint. Innervation. Tibial nerve. Plantaris. The plantaris is a small muscle which is absent in approximately 10% of the population. Attachments. Originates from the lateral supracondylar line of the femur. The fibers condense into a tendon which travels down the leg, between the gastrocnemius and soleus muscles. It blends with the calcaneal tendon and inserts onto the calcaneus. Actions. Contributes to plantar flexion at the ankle joint and flexion at the knee joint. Innervation. Tibial nerve. Clinical relevance. Ruptured calcaneal tendon. Rupture of the calcaneal tendon refers to a partial or complete tear of the tendon. It is more likely to occur in people with a history of calcaneal tendinitis, chronic inflammation of the tendon. The injury is usually sustained during forceful plantar flexion of the foot. The patient will be unable to plantar flex the foot against resistance, and the affected foot will be permanently dorsiflexed. The soleus and gastrocnemius can contract to form a lump in the calf region. Treatment of a ruptured calcaneal tendon is usually non-surgical, except in those with active lifestyles. Deep muscles. There are 4 muscles in the deep compartment of the posterior leg. One muscle, the popliteus, acts only on the knee joint. The remaining 3 muscles, tibialis posterior, flexor hallucis longus and flexor digitorum longus, act on the ankle and foot. Popliteus. The popliteus is located behind the knee joint, forming the base of the popliteal fossa. There is a bursa, fluid-filled sac, that lies between the popliteal tendon and the posterior surface of the knee joint. It is called the popliteus bursa. Attachments. Originates from the lateral condyle of the femur and the lateral meniscus of the knee joint. It inserts onto the proximal tibia, immediately above the origin of the soleus muscle. Actions. Lateral rotation of the femur relative to the tibia. This unlocks the knee joint so that flexion can occur. Innervation. Tibial nerve. Flexor digitorum longus. The flexor digitorum longus is a thin muscle and is located medially within the posterior leg. Attachments. Originates from the medial surface of the tibia and attaches to the plantar surfaces of the lateral 4 digits. Actions. Flexion of the lateral 4 toes. Innervation. Tibial nerve. Flexor hallucis longus. The flexor hallucis longus muscle is located laterally within the posterior compartment. This is slightly counterintuitive, as it is the opposite side to the great toe. Attachments. Originates from the posterior surface of the fibula and attaches to the plantar surface of the phalanx of the great toe. Actions. Flexion of the great toe. Innervation. Tibial nerve. Tibialis posterior. The tibialis posterior is the deepest out of the four muscles. It lies between the flexor digitorum longus and the flexor hallucis longus. Attachments. Originates from the posterior surface and interosseous membrane of the tibia and fibula. The tendon enters the foot posterior to the medial malleolus and attaches to the plantar surfaces of the medial tarsal bones. Actions. Inversion and plantar flexion of the foot. It also contributes to the medial arch of the foot. Innervation. Tibial nerve. Now let's have a quiz. 1. Which of the following muscles flexes at the knee and plantar flexes at the ankle? Soleus. Poplitus. Gastrocnemius. Tibialis posterior. The correct answer is gastrocnemius. 2. In which direction does the femur move to unlock the knee? Anteriorly. Posteriorly. Lateral rotation. Medial rotation. The correct answer is lateral rotation. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.